welcome to all our viewers and welcome to a new edition of Africa Today, our program bringing you all the latest news happening inside the African continent. Of course, I'll be joining you for today's episode. So let's start straight away with a look at some of the news making the headlines. Moving to a very exciting piece of news where the Egyptian Archaeological Mission has uncovered amulets and figurines of different shapes and sizes inside a sarcophagus in an archaeological site in Minya, Upper Egypt. A group of statuettes were discovered along with the sarcophagus last week at the site inside a 5-meter deep burial shaft. We have more details about this exciting discovery in this report.
Amulets and scarab figurines have been discovered in a newly unearthed sarcophagus of a high priest of the ancient Egyptian god Didoti in the Ghurayfa archaeological site in Minya, Upper Egypt. After opening the sarcophagus of Didoti Imhotep, a 26th dynasty high priest of the god Didoti, archaeologists discovered a collection of amulets and scarab figurines of different shapes and sizes. Mustafa Waziri, Secretary General of the Supreme Council of the Antiquities and head of the excavation mission, said that some of the amulets are heart-shaped and others depict the head of the god Hathor, the foreson of the god Horus, and a winged amulet. He added that more excavations in the area revealed another 10-meter deep burial shaft containing a large chamber with the 3 niches covered by stone beams. The sarcophagus was uncovered along with a collection on Shabti statues last week in Al Ghurayfa archaeological site inside a 5-meter deep burial shaft. This was the mission's 4th excavations season, where they found a well-preserved limestone sarcophagus decorated with scenes depicting the 4 sons of Horus. The archaeological mission started excavation in Al Ghurayfa in 2018 and has since uncovered many communal tombs belonging to high priests and senior officials of the 15th region of Upper Egypt. The mission unearthed 19 tombs containing 70 stone sarcophagi of various sizes and shapes, as well as the funerary collections.
And to continue with our news, the International Monetary Fund said that countries and institutions must do more to help African states weather the global pandemic and its economic impact, noting that the region has faced a projected financing gap of $345 billion through to 2023. We have the details.
The International Monetary Fund Managing Director Kristalina Georgieva said that African countries need $1.2 trillion through 2023 to resolve the challenges that resulted from the coronavirus outbreak. Georgieva made her statements during the high-level virtual event on Mobilizing with Africa, part of the International Monetary Fund and World Bank annual meetings that has kicked off on Monday. She said that some African countries are suffering from high debt burdens, forcing them to choose between debt service and additional social and health spending. Current commitments from the international financial institutions and official bilateral creditors are projected to meet less than a quarter of this need. She added that with private capital still subdued, there is a projected gap over $345 billion through 2023, and nearly half this burden in Africa's low-income countries. She added also that African countries spend an additional 2.5% of the GDP on health and social programs to meet their people's needs amid the ongoing crisis. While international financial institutions have provided significant financial assistance in fast-track support for them, which included around $26 billion from the IMF, and this is what has been helping them fight the virus and curb the economic repercussions on people and businesses. In Africa, there are more than 1 million infected cases with 23,000 deaths. Family incomes are down by 12% and up to 43 million people are at risk of extreme poverty. To ease the situation, Georgieva noted that IMF is working to extend the required support for these countries, including financial surveillance and capacity development programs. The IMF is also cooperating with international financial institutions to play a role in this regard.
And for more news, as the threat of COVID-19 emerged earlier this year, many, of course, felt a sense of apprehension about what would happen when it reached the African continent. Concern over the combination of overstretched and underfunded health systems, as well as the existing load of infectious and non-infectious diseases, often led to it being talked about in apocalyptic terms. We have more details in the story, and we'll be right back for a more in-depth discussion. Do stay tuned.
Many African countries have been praised for waging an effective campaign to combat the spread of coronavirus despite their reputation for having fragile state health systems. According to data compiled by the U.S. Johns Hopkins University, the continent, which has a population of more than 1 billion, has had about 1.5 billion cases. These figures are far lower than those in Europe, Asia or Americas, with reported cases continuing to decline. Africa has recorded about 37,000 deaths, compared with roughly 580,000 in the Americas, 230,000 in Europe and 205,000 in Asia. Low testing rates continuing to undermine the continental response. However, there is no indication that a large number of COVID-19 deaths have been missed. Quick response is one of the reasons that the continent has managed through the peak of the crisis. The first case on the continent was confirmed in Egypt on 14th of February. There were fears that the new virus could quickly overwhelm largely fragile health systems on the continent. So right from the beginning, most African governments took drastic measures to try and slow the spread of the virus. In a survey conducted in 18 countries in August, public support for safety measures was high. By 85% of respondents said they wore masks in the previous week. The implementation of the restrictions came at a huge cost. Livelihoods were lost on a large scale. South Africa, which had one of the most stringent lockdowns on the world, lost 2.2 million jobs during the first half of the year. The age of the population in most African countries is also likely to have played a role in containing the spread of COVID-19. Globally, most of those who have died have been aged over 80, while Africa is home to the world's youngest population with a median age of 19 years, according to UN data. A study conducted by researchers in the University of Maryland in the U.S. found a correlation between temperature, humidity, and latitude and the spread of the COVID-19. Several West African states which battled the world's worst ever outbreak of Ebola from 2013 till 2016 has also mastered the public health measures that have been used to prevent COVID-19, including isolating the infected, tracking the contacts, and then getting them quarantined while they get tested. Furthermore, in Africa's most populous state, Nigeria, teams that had been going into villages to vaccinate children against polio were quickly reproposed to educate communities about the new pandemic.
Welcome back, ladies and gentlemen, and we're now delighted to be joined over the telephone by our guest for this afternoon, Mr. Raouf Ghaffar, the political analyst. It's a very good afternoon to you, sir. Hello? Dr. Raouf, are you with us? Good afternoon, sir. Can you hear us? Right, apologies, ladies and gentlemen. We seem to have a technical error with the telephone. A short break, and we'll be right back, hopefully, with the fixed telephone. Stay tuned. Welcome back, ladies and gentlemen. We're now delighted to be joined over the telephone by our guest, Dr. Raouf Ghaffar. A very good afternoon to you, sir. Doctor, are you with us on the line? Dr. Raouf? Dr. Raouf Ghaffar, can you hear me? Right, unfortunately, another problem with the line. Doctor, can you hear us, sir?
Yes.
Yes, Dr. Raouf, a very good afternoon to you. Thank you so much for joining us.
Thank you. Good afternoon to you.
Apologies for the phone line issue, but let's start straight away. Of course, today we're discussing the COVID-19 pandemic and the expectation on what it could have done to the African continent versus the reality. A recent data compiled in a study has revealed that the African continent has in fact been spared the worst of the coronavirus consequences. What are your thoughts on this issue?
I think the African continent was hit hard, but in my opinion, was not affected as badly as other parts of the world, and this may be due to a few factors. In my opinion, the weather might have an impact on that.
Yes.
Africa being hot, etc., and this help prevent the virus from spreading.
Yes.
Probably saw the virus propagating in large density cities, which are, of course, in Europe and the United States, and of course in Asia. But Africa has very, very few big cities that are overcrowded. So maybe this is another reason. And again, in my opinion, the lifestyle of most Africans is not as luxurious as other parts of the world. So this means that they can, over the years, develop some kind of immunity.
Yes.
And they become more resistant to such viruses and illnesses. So maybe these are the reasons why Africa was also hit, but not as bad as other parts of the world.
Indeed. Doctor, now, how do you see, what are the challenges that Africa faces to really revolutionize its digital sector, tap into this very important sector, especially to face the coronavirus pandemic?
Well, I mean, of course, Africa is facing a lot of challenges, contrary to other parts of the world. So, first of all, we are not as rich as other, so we don't have the means to fight.
Yes.
And to buy ourselves maybe treatments or vaccines if ever they find it. So this is one challenge again that is facing Africa. Of course, we don't have the medical staff and medical equipment enough to combat such a pandemic. So we had to have recourse to other nations, maybe within Africa, and Egypt has helped a lot of African states to help face this pandemic by supplying them with all the medical supplies and equipment and what have you. So, I mean, this again is another challenge.
Yes.
That we don't have the means. Of course, one third channel is that Africa is rather, the economy of Africa is rather poor. So again, the production is not enough. So, I mean, these are a lot of challenges
Concerns,
that
yes.
face Africa, but thank God to inter-African cooperation, we could, sustain it, and hopefully we'll keep on going
Indeed.
further on.
Indeed, absolutely. Doctor, what are your expectations about a second wave of the pandemic that has, as we've seen, struck several countries, especially in Europe and the Americas?
No, please repeat the question. I did not hear you.
Sure, sir. I'm asking you your thoughts about a second possible wave of the coronavirus pandemic that has struck a number of countries worldwide, specifically in Europe.
No, I could not hear you. The voice is a little bit, I have a problem with the voice. So
All
please
right.
repeat your question.
Yes. Your thoughts, doctor, about a second wave of the virus that we've seen really in European countries, for example. What are your thoughts on a possible second wave in the African continent?
We pray to God it does not occur to Africa. We have seen it hit Europe and the States very hard, and unfortunately they are going into a second stage of confinement and close down, and this is and shut down, and this is not. Maybe European countries can sustain that, but unfortunately Africa will suffer more if ever a second wave appears. So we pray to God that it doesn't, and if it hits, let us cross our fingers and pray that it will not hit hard. And as we sustain the first wave, God help us will sustain the second, and we'll go through it, inshallah.
God willing, indeed. I'd like to thank you very, very much, Dr. Raouf Ghafer, our political analyst and guest for this afternoon. Thank you so much for joining us and for your insight on today's edition of Africa Today. Ladies and gentlemen, that's all the time we have for today. My name is Angie Meher. Many thanks for watching.